Hello everyone. My name is Ms. Tandai Moyo from Brave Little Hearts Zimbabwe, a support network for children living with heart disease. I began this project in 2018 when I lost my daughter to the disease. She went through a number of challenges that I rose to see that they only did not affect her, but many other children in Zimbabwe were being affected by these same challenges. Um, she faced a late diagnosis, just like any other children diagnosed with heart disease. They faced this major challenge of late diagnosis, and we also went through the challenges of accessing specialist care. As in the region where I stayed, we had no specialist doctors to look after the heart. And we also faced challenges with access to medication. Anti heart failure medication is not found in hospitals and clinics, but it is found in private pharmacies and it is very expensive. You look at a budget of approximately 50 US dollars monthly. And she faced the challenge of access to surgery as we were referred to India for her open heart surgery, and it was costing approximately 15,000 to 20,000 US dollars for us to go and get that life-saving surgery. But we did not have access to such kind of funding as much as any Zimbabwean today struggles both in the urban and rural setting to raise such kind of money to save their children. This burden escalates to the fact that very few children live up to the age of 5 years without medical intervention, which includes these life saving heart surgeries we are talking about. So, as an advocacy group, we are lobbying for our government to take up the burden of a CHD in our nation, to implement policies that can actually work to save lives in these communities. We are advocating for a compulsory oximeter reading for every newborn child here in Zimbabwe so that there is early diagnosis of this disease, as most of the times it is recognized very late when the child is now critical. We are also advocating for the equipping of our hospitals for these surgeries to be done here locally in Zimbabwe instead of children having to travel overseas, as many cannot, excuse me, raise the 15,000 or 20,000 that is required. We are also lobbying for the government to train more specialists to handle these children. Currently, we've only got two pediatric cardiologists, one of them stationed at Mpilo. She is the only one attached to government. The other one is a private cardiologist, pediatric cardiologist in Harare. And it does not suffice for the treatment of our children, as we are talking approximately 12,000 children every year born with this disease. One in every 100 children is born with this disease. The numbers are too high for us to ignore, and it needs a multi-sectoral approach in order for these lives to be saved. We are engaging with our Ministry of Health and other stakeholders in our country for measures to be taken urgently to save these children's lives. measures from early diagnosis to treatment and to aftercare. So it is indeed a long process, because while we're advocating for these local sustainable solutions, we have children who are urgently in need of surgeries. So we are trying that they be getting surgeries overseas, both in India and in South Africa. But in South Africa, the prices are a bit more on the expensive side. It's almost double that in India. So you find that most who can actually afford end up going to India despite the distances. Our hope is for our government to cultivate relationships with some of these countries locally in the Afro region who actually do these surgeries so that our children can be accessing surgery while we ourselves are working on our own homegrown solutions. So it is indeed sad, the impact of COVID-19 on these communities, because as you know, COVID has been very deadly, more so to these children who've got heart disease. We've watched and buried our children one after the other until we could not speak any more words of condolences to each other. And all we can silently hope for is that we have interventions and solutions, because it indeed is very difficult to watch your child die and know that there is nothing that you can do about it because you do not have access to resources. But in my understanding to the human rights, health is a right to every living human being, both young and old, and cardiac children need to access health equity and be recognized in their society. Cardiac disease is a number one birth defect killer globally, and so it is in our nation. Unfortunately, we do not have a national health registry for this disease, and we are advocating that it be implemented in our nation because this disease is 60 times more prevalent than the childhood cancer. But you find that cancer has all the resources and fundings that are needed for it. Yet a heart disease that is more prevalent has no resources attributed to it. So if you are listening to this audio and you feel you want to partner in any way, whether it is through donation of medications, through partnering, sponsoring surgeries, through helping to equip our cardiac unit, because we have established a cardiac unit at Mpilo Hospital. It's the first in the southern region, but it requires the right cardiac equipment like the monitors, the defibrillators, the x-rays, and even the echo machines for them to be at the pediatric unit. The one that is currently there at the hospital is overwhelmed as it only caters for 5 children weekly, and it also caters for the adults. It is at the adult section, and we are hoping to have one that is on standby specifically for children. We are also hoping to have a lot of awareness both in rural and urban settings, as there is a lot of stigma towards this disease. Not many people know about it. There is no health literature in both hospitals and clinics regarding regarding heart disease. So it's difficult for people to actually identify the signs and symptoms to the disease in relation to their children. So we would like a lot of um, health awareness material to be available in both in public spaces and in hospitals and clinics. So for those who would like to give a chance to children living with heart disease in Zimbabwe, please do not hesitate to contact us and to partner in any way. Whatever effort, be it in cash or in kind, it can go a long way to helping these children.